Good morning and welcome to the San Francisco Interfaith Council weekly online briefing for faith leaders. Today's program is all about the Delta variant. A special thanks. The San Francisco Interfaith Council weekly online briefings are supported by a grant from MetaFund. Thank you. The important ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a member. Follow SFIC on Facebook and Twitter. And subscribe to SFIC's YouTube channel to watch all of our previous virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Time permitting, we'll address your questions. To activate closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. San Francisco and surrounding counties are recommending masking in indoor public places for everyone as a precaution against the increased circulation of COVID-19. This includes settings like houses of worship, grocery or retail stores, theaters, and family entertainment centers. Get vaccinated, San Francisco. Since December, 1,800 people without the vaccine were hospitalized with COVID in San Francisco. Yet only 6 people with the vaccine were hospitalized with COVID. The vaccines are safe and effective. Go to sf.gov/get vaccinated to find a vaccine site in your neighborhood. Now is the time to come together, San Francisco, because together we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, call the SFPD at 415-553-1133. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for faith leaders. COVID-19 has taken many iterations over the past year and a half. The mortal threat it has posed prompted the imposition of necessary precautions and adjustments to our accustomed lifestyle. Just as most of those precautions were lifted mid-June, the Delta variant emerged, a mutation which has seen the hospitalization and deaths of the unvaccinated and proven relentless in breaking through the immunity of the vaccinated, albeit with less severe results. This week's online briefing for faith leaders, hosted by the San Francisco Interfaith Council, welcomes California Department of Public Health lead COVID epidemiologist Elana Silver, who will offer an explanation of the Delta variant, the state's present guidance related to the variant, and specific guidance for houses of worship and religious institutions. At this time, it is my great privilege and pleasure to welcome the founder of the San Francisco Interfaith Council, as well as past chair Rita Simmel, to offer a welcome and read the interfaith statement. Rita, the floor is yours.
Good morning to everyone and welcome. I'd like to read the following statement, which sets the tone for all our discussions. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer a prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we're free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. Welcome, everybody.
Thank you, Rita. As many of you know, this virus has disproportionately impacted the African American community as well as Latinx community. We are very blessed to have with us today Reverend Robert Shaw of the historic and important Bethel AME Church in the Fillmore District, who will ground us in a reflective moment. Reverend Shaw, thank you, and please lead us in prayer.
Thank you, and thank you for this opportunity. Good morning and greetings to all. I would like to open with a illustration by Dr. Larry Pettin, and it's entitled Covered Under His Wings. It was a hot day in the dry Old West. As the railroad came roaring down the tracks, sparks were flying everywhere because of the hot temperatures. When the sparks flew, often they would begin a fire that would destroy ranches, homes, and livestock. One particular day, there was a fire that spread from a railroad train in West Texas and did major damage. As the old farmer who owned the property walked through the ashes of his home and ranch, he saw an old hen lying on the ground, burnt to death. Her wings were spread open. In his anger, he kicked the old hen. To his surprise, several baby chicks ran out from under her burnt wings. When the fire came, the hen draped herself over her little ones and took the fire to save their lives. We have a Savior who did exactly that for us. When the fire of God's holy wrath should have consumed us, Christ spread out his arms on the cross and covered us in his blood. Psalms 91:4 says, he will cover you with his feathers, and under his wings you will find refuge. His faithfulness will be your shield and rampart. Let us bow and shall we pray. God, even in the midst of this COVID-19 pandemic and disease that has overtaken the world, we believe by faith, oh God, that you are covering us and that you are keeping us even in the midst of it all. You told us in your word that you will keep us in perfect peace as we keep our minds stayed on you. We thank you for the frontline workers, oh God, the doctors and nurses and those persons, the scientists and researchers and pharmacists who are on the front lines in this fight against this disease and against this destruction. We thank you for faith leaders and communities and partners and non-for-profits who are all doing their part in this fight against this pandemic. But most of all, oh God, we thank you for covering and keeping each and every one of us. Our hearts and our prayers go out to our families and friends who have lost loved ones during this pandemic. But in your covering, oh God, we will continue to lift up our eyes into the hills from whence comes our help, knowing that all of our help comes from the Lord who made the heavens and the earth. And it's in Jesus' name that we pray, and it's in Jesus' name that we ask it all. All of God's people together said, amen.
Amen. Thank you, Reverend Shaw, and continue to pray for us. We are very privileged to have with us today from the California Department of Public Health, the lead COVID-19 epidemiologist, Elana Silver. Elana, when we scheduled this, we were just hearing about the Delta variant, and it just seems like things are changing daily. And I know that even the slide deck that you prepared had to be changed in order to bring us up to speed. These programs that we offer, we have done with the blessing of the city so that we can provide the faith leaders of our city's 800 communities of faith and religious institutions with credible and timely information so that they can make informed decisions on behalf of those entrusted to their care. We welcome you, and we look forward to your remarks. The floor is yours.
Good morning. Thank you so much. I'm so happy to be here today. Can you see my screen? Great. Okay. Yes. So that really was a very good introduction. Your timing is impeccable to have me come speak about the Delta variant, because obviously it's spreading just incredibly quickly right now. And so I'm here to tell you what I know about it. So why are we concerned about variants? A few reasons. They may transmit more easily or be more infectious. They could evade the immune response, so they could cause people, even after they've been infected, to be still susceptible to be infected again, or in some cases, they may make the vaccine less effective. Certain variants could be more pathogenic, meaning they cause more severe illness, more hospitalizations, more deaths. They could make vaccines less effective, and they could cause diagnostic tests to not be effective. So that's not about Delta in particular, but that's in general why we're concerned about variants. And so next, what do we know about Delta? The data shows that Delta is actually different than past versions of the virus. It's much more contagious. However, it doesn't appear to cause more severe disease, so it's not more virulent. We continue to have good evidence that our vaccines are safe and effective, and that they provide protection against the variants circulating in the United States, including Delta. Also that they prevent severe illness, hospitalization, and death against the Delta variant. So this graphic shows how the virus, the COVID-19 virus, SARS-CoV-2 mutates. And this is kind of an old slide. It's from February 2021. So it doesn't even have Delta on it. It's from before Delta emerged. Delta emerged in California in March 2021. I like this graph though, and I'm showing it anyway, because what it illustrates is how viruses mutate. I mean, viruses always mutate. That's what they do. And what's interesting here is that you can see this here is the root of the pandemic from Wuhan, called A, and then different variants have emerged, and some of them went extinct, like this A1 from Seattle. It's just died out, and some variants do that. Others continue to evolve. And what you see in these blue and red squares, it's showing different mutations shared by different strains. And what it shows is that the same mutations arise independently in different places in different times. And the reason why that happens is because those mutations confer some advantage. They're more infectious, or for whatever reason, they allow the virus to be more successful. So this now shows what the data we have in California. So this comes from about 87,000 patient samples from California, which have been sequenced. Their entire genetic sequence has been spelled out and submitted to a sequence database. This is just a small percent of those infected with COVID, but it's a pretty good way of assessing how frequent the variants are. Over the whole course of the pandemic, really only a small fraction of cases has been sequenced, but in the most recent months, it's been up to 18 or 20% of cases that get sequenced. And so what this graph shows over time, the percent of specimens sequenced that are each of these strains. So first, starting in around September, October 2020, we started to see the first really widespread emergence of a variant, and that was what's now being called the Epsilon variant, or you may have heard it called the West Coast strain, B1427 and B1429. So that started growing very quickly and peaked in early 2021. But then as a new variant, Alpha started to emerge. The Alpha is the B117 variant that was originally described in the UK. As Alpha started to emerge in January 2021, it had an advantage over Epsilon. And so Epsilon's frequency started to decline as Alpha's frequency rose. And so you had this peak, we saw this peak of epsilon, this peak of alpha that looked pretty similar. And then again, alpha started to decline as a new predominant variant, delta, started to take over in May 2021 is when it started sharply increasing. The gamma variant, we saw a little peak of as well, but it never became as prevalent as some of the other variants that we see. So that last slide that I showed was California data. It's available on the CDPH website. This slide is national data from the CDC. So it's a different kind of graph, different way of showing the same data, but the results look very, very similar. So what it shows in the bright orange bars is the frequency of the Delta variant. Another name for Delta is B.1.617.2. And so you can see, it started out small and now comprises over 83% of samples. These are 2-week periods. Each bar is a 2-week period. And during that same time, alpha continues to decline from almost half of samples in mid-June to 8% of samples now. And similarly, gamma continues to decline from about 10% of samples in mid-June to about 3% now. There is a time lag between when a sample is collected from a patient and when the data, whole genome sequencing data, becomes available and posted on websites like this. It's typically, that delay is typically at least 10 to 14 days, and it could be longer. So this graph is again California data, and it's the same data I showed 2 slides ago, but a different way of looking at it. So again, over here, we're looking at time. And you can see from when we first started looking at, and so the purple is the alpha variant, blue is the gamma variant, green is other, and yellow is delta. And so back in, I don't know, this is probably March or April here, there was some frequency of alpha variant that was significant. That was the most frequent variant we saw at that time, a little bit of gamma. And then most of the samples were other strains. There's over 300, maybe over 400 strains that have circulated in California the whole pandemic. So there's, that's what was shown in the green. But then over time, you can see how delta became more and more and more frequent, displacing all these other strains until now. It's where it's greater than 80% of samples. This is data for the state as a whole. We also look at this regionally, and what we see when we look at it regionally is that variants, including Delta, usually begin spreading in Southern California and then to the Bay Area, and then to Sacramento, and then to other parts of the state. And that could reflect a few different things. One, it could be that those are the big population centers. That's where a lot of people live. That's probably where a lot of people travel internationally. Also, sequencing is not uniform throughout the state. So we know that there's more sequencing happening in Southern California than there is in some other parts of the state. So that also explains some of the regional differences we see. But, the pattern is pretty similar, throughout the state. Delta is the predominant variant. This graph shows the how much sequencing is happening in California. The gray bars show the total number of specimens of samples taken from patients that have been sequenced. And you can see, I think I mentioned this already earlier, that at the beginning of the pandemic, it was fairly low. There wasn't that much sequencing happening. It took a while, as you recall, even for testing to be effective. But then starting in fall of 2020, sequencing started to pick up until in recent months, it represents about 18 or 16% of samples that we have are getting sequenced. You see the sharp drop in recent months, but that just reflects that delay that I mentioned earlier of the 10 to 14 days before sequences become available. So our goal at the state is to have at least 10% of cases sequenced, and we have been meeting that in recent months. So the Delta variant has caused a sharp increase in hospitalizations and case rate across the state. The data shows that Delta is different than past versions of the virus. It's more contagious. And even vaccinated people can get infections with Delta after they get their vaccine and could be contagious. That's different from what we've seen with other variants. However, vaccinated individuals represent a very small amount of total transmission. So the guidance on do I need to wear a mask obviously has changed a lot in the last few days. This is a slide from CDC. CDC announced, I think 2 days ago, that in areas of substantial or high transmission, everyone should wear a mask in public, indoor settings to help prevent the spread of Delta variant and to protect others. And again, this is because for unvaccinated people, it's, to protect yourself from getting infected. For vaccinated people, it reflects the new understanding that although it's rare, that people who get vaccinated can be infected with Delta and can be very contagious as non-vaccinated individuals, perhaps. On the right here, so this guidance applies for areas with substantial and high transmission. So what does that mean? This website of CDC's shows a map of the whole country, color-coded, and the red is high transmission, the orange is substantial transmission. And so those are the two colors where it's recommended, where CDC is recommending that everyone wear a mask. More than 90% of California's population, including the whole city and county of San Francisco, is currently designated as substantial or high transmission. And for that reason, yesterday, CDPH came out with new recommendations recommending masking in indoor public places, regardless of vaccination status, to slow the spread while we continue efforts to get more Californians vaccinated. And then on the bottom here, I have a link to the new CDPH guidance that came out yesterday. Another thing California did this week is we took the nation-leading step of requiring state and healthcare employees to provide either proof of vaccination or submit to regular testing, mask wearing, and travel restrictions, other things like that. And it looks like the federal government is going to follow suit today with a similar order. Right now, we really need to get more people vaccinated. The vaccination coverage in the US ranges from 9% to 89%. And in over half of the counties in the US, it remains below 40%. And what our data shows in California is that you're 6 to 7 times more likely to be a case if you're unvaccinated, and you're 10 times more likely to get hospitalized or die. We also see in areas of low vaccination coverage that there's rapidly increasing case counts. And throughout the nation, COVID-19 cases have increased 300% in the last few weeks between June 19th and July 23rd, driven by the Delta variant. However, importantly, while we are seeing case numbers similar to the wave we experienced last summer, there are over 70% fewer deaths, and this is largely due to the impact of the vaccine. Where we are now is in a race against time to increase vaccination coverage before new variants emerge. So what should communities do? The people here, I think you're in a unique and important position to strengthen the health of our communities. So community leaders should encourage vaccination and masking to prevent further outbreaks, especially in areas of substantial or high transmission, including San Francisco. What I like to tell people is that, people feel like, or maybe before last week, people felt like, okay, we're out of the woods, we're safe now. But the message that I like to give is that if you're unvaccinated, what was risky before, what was risky last year, it's even riskier now. Because we're in this situation where some people are vaccinated and some people are not, and they're mixing together, and that's a prime opportunity for the virus to continue to mutate in that way that it likes to do. And that's why it's really important to be taking precautions now. We don't have specific guidance for places of worship. We did previously under the blueprint rules, but I think the just general rules about indoor settings that I went over earlier apply obviously to places of worship, and that's what I would recommend that you would follow in your communities. We do see transmission in religious settings. That is something that we're tracking at the state, and so we ask questions to cases about whether they've attended gatherings and what type of gatherings. And we've seen that 8% of cases report gatherings in a religious setting. So I think this is really my last slide. And so I'll just repeat and end on the note that I think the most important thing all of you and that we can do right now is to encourage vaccination. And I was very pleased to see that that's how this meeting began. I know things are changing very quickly now. I put my email address on this slide, and I'll stay on now for questions. Feel free to reach out to me with any questions. And thank you for your time. Really appreciate being here today.
Elana, thank you so very much for giving us this macro view and up-to-date view. One of the things that impressed me about the macro view is that we need to get people vaccinated, not just even in California, but everywhere, because of where people travel to the Bay Area, they travel to California. Since the outset of the pandemic, the state has been giving us guidances, and then those guidances come through our local Department of Public Health that issues their directives and health orders. So we thought that it would be helpful to drill down today, and we've invited Dr. Navina Baba to be a respondent to take what you have said from the California Department of Public Health and give us a perspective here for the San Francisco Department of Public Health. Dr. Baba is no stranger to this program. She has appeared previously on briefings. She is the Deputy Director of Public Health, and we welcome you back, Dr. Baba. We invite you to unmute and please, I know you have some slides to share too, so the more specific for our attendees would be appreciated. Thank you.
Thank you for that introduction. And yeah, if I could get my slides. I just want to give everyone a little bit of context of where we are in San Francisco and potentially where we're headed. So my name, as was mentioned, is Navina Baba. I'm the Deputy Director at the San Francisco Department of Public Health. Next slide, please. So this is an overview of how San Francisco is doing. Overall, we have almost 40,000 cases since the start of the pandemic, and our 7-day rolling average is about 149 cases. Currently, there are about 61 people hospitalized, and we've had a total of 561 deaths, unfortunately. In terms of vaccine, San Francisco has really done well with vaccine. 69% of everyone in San Francisco is fully vaccinated, and that includes populations that are not eligible as the denominator. So overall, we have a 69% fully vaccinated rate. And then of all residents, at least 76% have gotten one dose. So the total number of residents that have been vaccinated is about 660,000. Next slide, please. And then in terms of where we are on this surge, on the left-hand side, you'll see the graph of our cases. So right now we're about at 149 cases that have been reported per day. And you can see this actually exceeds last July's surge. So if if you remember back in July 2020, there was actually a surge at that time. It was one of our first surges. And we are at a higher case rate. And actually the rate of acceleration is higher than what we even saw in the winter surge. So those are all concerning for us. And then additionally, the lower bottom screen, you can see our hospitalizations. Our hospitalizations are going up. They are lower than they were last July, which is great. And that potentially could be due to vaccination, but we'll have to see where it goes. You can see the winter surge we had a high number of hospitalizations and it peaked at 256. And then just in terms of how this relates to the rest of the world, cases are, again, increasing across the world. So we'll have to monitor that. Next slide, please. In terms of where cases occur geographically in San Francisco, since the beginning of the pandemic, the southeast sector of the city has been most impacted by COVID. And that really is accounted for by our communities of color that have unfortunately bear the burden of this disease. So our Latino populations and our Black African American populations. Our deaths have been disproportionately high in Asians, Black African Americans, and Latino communities. And this continues to be the story in terms of, at least for cases, that the Southeast sector continues to be where we see our case rates very high. So our testing efforts and our vaccine rollout have all been driven by this data, but also by our community-led and community-focused response, including close partnerships with the Interfaith Council and our faith-based leaders to get the word out. And that has been proven to be successful. Again, if you look at our numbers in terms of total vaccine percentage that have been vaccinated, it's very high, and in the Southeast sector, it also is fairly high too, even though there are some communities that are lagging. Next slide, please. So Elana talked a bit about this and what a variant is, and I'll just kind of talk again, very high level. We know that viruses change and they are constantly mutating, and a variant is a version of the virus that possesses mutations. Some of these variants are inconsequential and they disappear, but some of them actually persist and become more common. And through genomic surveillance, we can determine which ones end up being variants of concern or variants of interest. From a public health perspective, we're concerned with variants that affect the virus's SARS-CoV-2's ability to transmit, or if it causes more severe disease, or if it prevents it from the vaccine or treatment would be less effective because of the variant. So those are all reasons that variants may become variants of interest or variants of concern. And as was mentioned, the Delta variant is the predominant strain in San Francisco, California, and the US. The Delta variant is more contagious, so that means it spreads more easily. But as it was mentioned, it does not appear to be more severe, although there's still some studies going on about that, and vaccine and treatment still seem to be effective. Next slide, please. So what can we do? The most effective way to reduce the emergence and spread of variants is to stop this transmission of them. And the best way to do this is by preventing the ability for the virus to spread. The virus can't mutate if it's unable to replicate and if there's no host that it can go to. And that's really what vaccine is aiming to do. So the more that we can get people vaccinated, the more likely we'll be able to slow the spread of the virus. Hospitalizations and deaths due to COVID are now preventable with vaccine. So we know that masking and testing continue to be important for the time being, especially while we're in this surge. But vaccines are the gold standard, and that's what's going to get us out of the pandemic in the long term. The vaccines have been proven to have real-world efficacy, and they're also very effective against the Delta variant in terms of hospitalizations and death. Next slide, please. So there have been no COVID-related deaths among those who have been vaccinated in San Francisco. And there have nearly been none across the state and the country. COVID case rates among vaccinated versus unvaccinated are substantially different. So some of you might have heard about breakthroughs, and breakthrough cases are basically people who are vaccinated who get COVID, and that does happen. But the people who get COVID after vaccination tend to have very mild disease. So you're less likely to experience any severe symptoms, you're less likely to be hospitalized, and you're very unlikely to die of it. There still remains a group that is ineligible. We have to remember there still remains a group that's ineligible for vaccines. So the most important way that we can help protect them is for everybody around them to get vaccinated. And I'm talking about those under 12, as well as those that medically cannot get vaccinated. Next slide, please. So finally, I wanted to talk a little bit about the timeline that we've had more recently, because I know some of the guidance has been confusing. In July, a couple weeks ago, San Francisco and 5 other Bay Area County health officers recommended wearing a mask indoors in public settings to manage Delta, and that was regardless of vaccination status. Last week, San Francisco, Contra Costa, and Santa Clara actually recommended business adopt COVID-safe workplace policies, including potentially requiring employees to be vaccinated. Businesses are always permitted to go above and beyond our guidance and recommendations, including confirmation of vaccination status. And then, as was mentioned on Tuesday and Wednesday of this week, the CDC and CDPH also recommended masking indoors if you are in a geographic place that has substantial or high transmission, and that includes pretty much all of California. So these recommendations are meant to see if we can really turn the curve on the case rates that we're seeing, as well as ensuring that our hospital capacity remains sufficient. We knew as the economy reopened, we did expect to see case rates go up, but given that Delta is here, that transmission rate has really increased. And this is just, because Delta is here, one of the things to note is that with COVID, there's no such thing as a safe environment. There are safer environments. So for example, when you're thinking about you or your family, if you have children, we always recommend outdoors is better than indoors. Being able to maintain social distancing is important. So just all those considerations as you engage with people and in different environments. And I think the most important thing for us in public health is we really do want to ensure that children can go back to school just here in a couple of weeks. And so a lot of our recommendations around this is to try to get, our case rates at a place where schools can reopen successfully and stay open. And it's, again, a reminder that a lot of children are not eligible for vaccines, so really wanting to protect them as well. Next slide, please. And here are some links that have helpful information, including the information that I just presented, and we can definitely provide this afterwards as well. That's my last slide.
Okay. Thank you, Dr. Baba. Did you have any questions of Elana before we head into our Q&A portion of this program?
Sure. I think one of the things, Elana, that has always come up for the public specifically is this question of breakthrough cases and what that means. So I talked a little bit about breakthrough cases versus hospitalizations and deaths, but I don't know from the state level if you wanted to share some more specifics around that.
Yeah, thanks. That's a good idea. I just put into the chat a link to our webpage that goes into the data we've been collecting on post-vaccine cases. So they're rare. So I'm reading off the webpage now for the most recent week where the data is available between January 1st, 2021 and July 22nd, 2021. Out of 21 million fully vaccinated individuals, a very small fraction, 0.1%, have been identified as post-vaccination cases. That's about 21,000 individuals. Of those, about 900 were hospitalized. Less than 100 have died. However, it's not really known if the primary cause of death in those cases was COVID-19 or if there were other contributory or alternate causes. But we are collecting that data. Unlike CDC, at CDPH, we're looking at anyone who tests positive after a vaccine, not just CDC is only counting as breakthrough cases, people who have severe disease or hospitalization. But because the evidence is emerging that people, even vaccinated people, can with the Delta strain can transmit infection, it's important to track those people. So we definitely want to make sure that we're counting those and that we're paying attention to those. So these numbers include that. What we've seen is that vaccinated people are much less likely to get severely ill, to be hospitalized, or anything like that.
Dr. Baba, were there any other, and Elana, if you had any questions of Dr. Baba, in terms of what's going on here on the ground in San Francisco, this would be a time to pose them.
Just thank you and the other San Francisco leaders and Bay Area leaders for your leadership in this area. A lot of times the Bay Area counties have acted before the state. The state, we talk about it and we think about it for a while, but it's really, I think, just really valuable to have forward-thinking leaders like in San Francisco taking action early, and that provides the push that the state needs. On the state level, it's difficult because California is so large and so diverse, and there's just a lot of different opinions and considerations when giving advice to the whole state. But it's, from my point of view, it's really helpful when we see people taking strong health protective stances in other parts of the state. So we appreciate that.
Thank you. We have a number of questions from the audience, and I believe we have time to get to all of them. And Dr. Baba, don't go too far because we might need to engage you. Just a curious question. We've been encouraging people to get vaccinated. We've been encouraging people to wear masks. Are we still encouraging people to get tested? And are those tests as easily accessible?
Yes, I would say, if you've been exposed or if you have symptoms, if you're concerned, I would encourage people to get tested. I've seen for myself that it's much easier to get tested now than it used to be. The lines at the testing center at San Francisco Airport are hardly there. I remember when it was very crowded, but now you drive by and it doesn't look like you'll have any trouble getting a test. I've been able to get tests, rapidly when my son had a potential exposure at school. And yes, I do think it's important to have that data so that we have an accurate picture of where the virus is circulating and how much it is.
Dr. Baba, I know that the COVID Command Center has pretty much shut down at Moscone, but I think you all put the infrastructure in place. And so if there's anything you wanted to add to that as a response.
Yeah, I agree. Testing continues to be very crucial in this pandemic, and especially as we see case rates go up. So we have, changed our, we've, really used a hyper-local response for our testing and are tracking where the disease is. And so most of our testing is in the southeast quadrant of the city, but testing should be available through, your healthcare provider. And there are definitely ways if you're having issues getting a test, you can go onto the city government website and see where our free testing is available. There should be appointments available for people if they want to get tested.
Okay, stick around. We have a number of questions. The first, I'm going to take them in the order in which they were submitted. Saw an item that the CDC has found out that vaccinated people who test positive have the same viral count as those who are unvaccinated. Thus, the spread of this is really ramping up. Curious if any further background or comments you'd like to make. This person says this was being presented as backup for how everyone indoors should be masked.
Yeah, I think I know what data that's referring to, and that's studies that have looked at what we call CT value or cycle thresholds, which is basically a measurement of how infectious a person is, how high their viral load is. And there have been a few recent studies looking at that cycle threshold in people with the Delta variant and vaccinated people with the Delta variant. And yes, what this early preliminary data is showing is that the viral load, the amount of virus in your system with the Delta variant, even in vaccinated people, is very high. So that's a very dangerous position to be in, where you have, some people who are unvaccinated still mixing with people who are vaccinated. The vaccinated people aren't having symptoms, they may be infected and they don't even know that they're infected because the vaccine's protecting them so well that they don't have symptoms. But if they've gotten infected from an unvaccinated person who they crossed paths with, they could be, very contagious and out there in the world. Hopefully now they're masked, but they could be out there in the world and be very contagious. So yes, that's really, I think those studies are, I think, the main reason why CDC and CDPH came out with this new mask guidance, because it's clear that people can be not sick, but transmitting illness.
One of your initial slides, Elana, fascinated me. I'd never seen it so graphically put, the alpha, beta, gamma. And this person asks, I would be interested to know what the recent decline in cases in the United Kingdom and in India before that tells us about what might happen in the coming weeks and months here.
Yeah, that's the $1 million question, I think. Case rates, and especially deaths and hospitalizations are not looking as high as they were last summer. So yeah, I think we can hope that case rates will decline. I think the real question is what happens with variants. Will it mutate again? Will new changes happen? So I don't feel like I can make predictions about what's going to happen, but it is encouraging to see case rates decline in some places. Of course, they're rising in other places too.
This person asks, this might not be the right place for the question, but is there any information regarding extending the California COVID supplemental sick leave? It is set to expire September 30th.
Yeah, sorry, I don't actually know about that.
Why is it disproportionately affecting people of color in community? Maybe Dr. Baba, you want to touch upon that?
Yeah, I think early on in the pandemic, we saw the community, specifically the Latino community, they were frontline workers and did have to go out every day and were exposed much more so than and other communities of color were exposed more so than others. So they were essential workers and also potentially living in crowded households. So had the exposure and then potentially bringing it back home with a large household. So that unfortunately is where that the initial case rates increased. As I mentioned, right now, there is a bit of a lag in where we're seeing vaccination and our vaccination rates are slightly lower in our Black African American community, and that might be contributing to why we're seeing some higher case rates in that community. So there's a lot of community-based organizations, faith-based leaders, trusted community leaders that are working with, sending out messages, figuring out how we can help combat misinformation. There's still a lot of misinformation about vaccine out there. So, and their efforts they're working. We're definitely, slowly seeing increases. It's just going to take some time.
One of the roles that the Interfaith Council has played since the outset of the pandemic is not only to provide this information, but where there's confusion, to get clarity. And this person asks I'm glad this person asked the question because I was thinking it. Would you please explain sequencing? What is learned from sequencing?
Yeah, that's a very good question. And I probably should have started with that, but let's, so a virus is basically just a ball of nucleic acid of, in the case of COVID, RNA. Most viruses have RNA, but it's closely related to DNA, which is the nucleic acid that humans have. So viruses don't have much else. They just have this RNA packet, and then they invade human cells and take over the cell's machinery to make copies of themselves. So there's different kinds of tests we use to look for the virus, and PCR test, which you've heard about a lot, is just looking for, is there virus RNA or not? Yes or no. And so the PCR test takes a little snippet of the nucleic acid material and looks for it. Sequencing goes a step further and takes more time, it's more expensive, it takes a lot of computing power because there's 30,000 individual bases making up the SARS-CoV-2's genome, the genetic material. And so that's 30,000 A's, C's, U's, or G's. And when a lab does sequencing, they read off all 30,000 of those base pairs and compare it to a reference genome, and all of the changes are highlighted, so to say. So if certain changes exist, then it's variant Delta. And if a different set of variants of changes exist, then it's a different variant Alpha. So that's what sequencing is, and it tells us which strain we're dealing with.
Thank you. Dr. Baba, I think maybe you'll be able to answer the next question. Yesterday I was walking down Chestnut Street, and it's, just a string of restaurants. This person asks, and you can't wear a mask while you eat, but this person asks, are there specific guidance for restaurants and or other group meal settings?
Yeah, definitely. I mean, I think one of the things, as I mentioned, there are ways to make your environment safer. And so a lot of restaurants are offering outdoor seating, which, I would consider doing. It is likely just because of the ventilation and circulation that you have outdoors, you'll be less exposed. And then really when you're eating, especially if you're eating with somebody from a different household, trying to, see if you can maintain 6 feet away, if you can sit across from each other, and really after eating, put your mask back on, or if, hopefully you'll be not too close to another table as well, trying to get that 6 feet distancing. So there are definitely ways to think through how, if you do want to go out and eat at a restaurant while Delta is circulating, how to make that a safer experience for you and your family.
This person asked a question which hits close to home. How does the Delta variant increase the impact of singing among vaccinated choirs? And I'll let both of you go at that.
I don't think there's any specific data on singing yet on the Delta variant, and nothing that I've seen, but just given what we talked about before, that people may not know that they're infected because they're not having any symptoms, and they can still be highly infectious. I would think that it's even more of a concern, and it would just emphasize the importance of having everybody in those choirs vaccinated to give as much protection as possible.
Dr. Bob, anything else?
Yeah, and I think I would just say also considerations for the audience. So specifically, if you have children in your audience that are not necessarily going to be able to vaccinate. So some of those things might be things to think through if you are doing a choir performance.
Here's another question about indoor closed settings. Theaters and arenas indoors are scheduled to open up with hundreds to thousands of people sitting elbow to elbow. So what to do or suggest people do?
I can tell you in San Francisco specifically, we have said, that actually if the theater population or the indoor sporting population is more than, if it's a mega event, you have to show proof of vaccine. And that proof of vaccine has to be a little bit more than an attestation. So that has been incorporated into any of these big, larger mega events indoors. And then again, masking considerations indoors as well.
This person asks, is the N95 mask currently being recommended for all?
I don't think that that's a specific recommendation that CDC or CDPH has said. I believe that it's still, any cloth mask is okay. The data that I've seen shows, as long as it's tight fitting and fits you properly, that the cloth masks are very effective. And you can find different comparisons of different kinds of masks, but N95 is certainly recommended in hospital settings and medical settings, but I haven't seen a recommendation of that for everybody in all settings.
This person asks, is the recent surge in SF most the Delta variant?
Yes, it is most likely due to the Delta variant. We know in the Bay Area region, about 80% of cases are likely to be due to Delta, and that's mirrored in the state data as well.
The next person asks if you would drill down a little more to talk about children under 12 and their exposure and vulnerability. To me, with schools opening and the like, this would probably be one of the bigger concerns for the city as well as the state.
Yeah, and I think, again, all of us are working very closely together from the state to the local health officers to really make schools successfully open to provide that support. There's a couple differences between adults and children in terms of being, getting infected and then being able to transmit. And what we have seen with our data in schools is generally children don't transmit to each other. They really get COVID from their household. So a parent at home who has been infected and is living with a child. So that just points to the fact that there are some safety measures that can be done at home to prevent children from getting infected. And then at schools, we know that what can make a school a safer environment is really masking, ventilation, and all of that is being incorporated into our guidance. And we're working with all of the schools to make sure that they are following that guidance, and if they need support, providing that support. And then doing testing if people have symptoms or they've been exposed. So that kind of whole wraparound should be enough to successfully open schools. And we've seen that actually in the UK and Israel, when they've had all of those mitigation strategies in place, it does seem like schools were able to successfully stay open. It's when you take away those strategies. So if kids are unmasked, or if the ventilation is really poor, or if you're not doing testing for people who are symptomatic, that's where you get into trouble.
Elana, did you want to add anything to that, or are we good?
No, I think that
Okay.
covered it very well.
And we will just for the benefit of all those listening, our August 12th briefing will be focused on school reopening, both public as well as the religious schools. So we will be getting into the weeds on that. This person asks, what does the data say, recently from Israel, I believe, about those who have had COVID and what level of immunity that may come from that?
I think the data I've seen seems to say that there is protection conferred by previous infection, but it's not as robust and long lasting as the protection given by the vaccine. But if you have both the prior infection and the vaccine, that's really very good protection, the two of those together. The mechanisms for this protection are still not that well understood. The immune system's very complicated, and there's only some parts of it, like antibodies, that are relatively easy to measure. There's also things like T cell protection, which is just, we barely scratched the surface of being able to quantify it. And so it's hard to do those real world studies. But even if you've been infected, we do recommend vaccination.
I'm gonna combine these two. We only have just a couple more questions, and I think we can get to all of them and satisfy everybody. Can you define a mega event, and are there changes expected for inside venue capacity restrictions?
So a mega event is 5,000 or more indoors. There are no changes anticipated at the local level. I don't know, Elena, if at the state level there's any discussions.
Yeah, I'm not aware of any changes being considered at the state level either.
And the last, there have been so many questions in the chat about the N95 mask. And so I just want to, I'm just going to put this last one out to you. This may have changed, but back before COVID, during the bad air quality events, it was stated that N95 masks are not made for children. They do not fit properly. N95 fittings are very important. So if you just want to respond to that.
Yeah, I agree with that. N95s come in different sizes, and I got fitted for one at the beginning of the pandemic. And what they do is they put you in your head in a little chamber, and they put the mask on you, and they pump in some harmless liquid or spray that has a smell, and ask you if you can smell it. And if the N95 mask is working properly, you won't be able to smell it. And so you can test if it's working or not. Another thing I like to do, I wear glasses, and if the mask doesn't fit me properly, my glasses will fog up. But if my glasses don't fog up, then I know that the mask fits properly.
Actually, we actually do have two more quick questions. Do you think we will need booster shots?
Yeah, that's a great question. And the data is continuously being reviewed as it becomes available. But the latest recommendation from CDC and the Food and Drug Administration came out just a few weeks ago on July 8th. And they stated at that time that fully vaccinated people do not need booster shots. But federal agencies continue to review the data, and especially in light of the new variants, and CDPH and the other work groups that we work with are monitoring that closely.
We have one final question, and it actually is coming from our faith-based roundtable. How likely do you think California Department of Public Health, San Francisco Department of Public Health will update to require versus recommending masking?
I don't think CDPH is going to do that, because I know that that was considered, and the recommendation that came out yesterday was a recommendation, not a requirement. That's just my informed opinion, but I don't know for sure.
Yeah, and locally, we're looking at the data, and throughout the Bay Area, the other health officers are looking very closely at the data, and considering whether indoor masking should be a requirement.
I will tell you both. Two of our largest adjudicatories, the Archdiocese as well as the Episcopal Diocese of California, are both requiring it for worship at this point. So we're being a little more cautious than I think even the state or the city and county. I want to thank you both for your contributions today, your preparation, and for so clearly articulating for our faith leaders. We had a robust conversation today, and we had a large number in our audience, and this again will be sent out to our 5,000 e-subscribers. So thank you. I want to thank Cynthia Zambucas and Trey Russell Allen for all of the work they did to make this possible. And we'd like to invite everybody to join us on Thursday, August the 12th, 2021 at 8:30 a.m. when we will devote our time to addressing the impact of COVID-19 on school reopening for students, their families, school administrators, and teachers in both the public as well as religiously affiliated academic institutions. This concludes today's program, and we just thank you all for participating and continuing to spread the word in your communities so that we can all be safe. God bless you and God keep you.